People can barely figure out how to pick up a cell phone without screwing it up and getting involved in a plan. And you can live without a cell phone. You mess it up when you're out there at the, listening to various healthcare company ads. You mess it up, and you may end up owing more than if you would have not had insurance in the first place, or you may just be throwing money away. What makes you think that just turning this over to the free market is going to give people any better coverage than what they have now, or what they could get by just simply showing up in the Medicaid office?
Well, I think
Not cheaper, but better. How's this actually going to help people?
well, it helps people by letting them pick what they want, and hopefully they will be provided a reasonable plan, group of plans to pick from. And there's always advisory people willing to help folks with their problems of this nature. When we got Medicare Part D, what did we do? Well, it has some tendency to a free market system in some ways. So the next thing you know, the pharmacies are looking at these people's drugs and giving them advice on what the best plan for them would be. That's going to happen again. It's going to say, these are the plans for you. There's going to be a computer program. Put in what you want and see what plan fits you the best. Don't tell me that's not going to happen. We all know it will. Okay? And that's going to allow people the benefit of people's expertise to choose plans. And so, believe me, there will be, I think, brilliant solutions to these concerns when we open this thing up. But we've got to start acting more brilliantly in the area of health insurance than we are currently, because all we've done is create this morass that nobody understands, is ungodly costly, and just simply can't continue. 40 million uninsured in this country. This is absurd.
But doesn't Medicare Part D prove the point that some of us are asking about? Because a lot of people still say we're overwhelmed, there's too many choices, too many options, we don't know where to turn. People start feeling paralyzed. We heard this over and over again during the sign-up period, that people just say, I really don't know where to turn because I'm scared to death of making the wrong choice.
Well, I think it was very difficult at first, and I don't think that Medicare Part D was perfect. But all in all, I've been impressed with how my patients have negotiated their way through this and how generally pleased they are with the program. I think it could be simpler, and I think people should almost demand that it's simpler, but the government regulation in it is a little too complex for my taste. But I think, by and large, the patients have taken to Part D quite nicely, and I think if we can provide something even simpler than that, we'll be making their lives better, easier, and they'll be healthier when they know what to do.
Do you know how you penalize insurance companies for if they decide to discriminate? Because some companies could just say, hey, that's just part of the cost of doing business. It's cheaper to pay a penalty than to insure people who are going to drive up our costs in the long run.
Depends on how large the penalty is. We'll make it large enough that they change their minds.
Any single one of these programs, plans, points, would be difficult to accomplish, either on the state legislative level or certainly in Congress. What makes you think that you could come in and with one foul swoop get 12 or get any of the 12?
Well, I think the key is you got to get all the 12. I mean, you either want to do what we're doing or you want to do something different. If you want to do what we're doing and play around with it, I get a little discouraged with some of the presidential candidates and how they just want to tweak this or tweak that or change this little. So, in essence, create probably more bureaucracy and solve nothing. If we don't start solving something fairly soon, then we're not going to get this thing done. If it requires radical reform, then so be it. Some people look at this plan and they say this is radical. Fine. So it's radical. Big deal. It's still right. What we have is wrong. This is right. We better do something right for a change. I'm tired of living in a state and a nation where we don't seem to be able to get anything right.
Who goes to prison, doctors or moms who commit Medicaid fraud?
Depends on who does it, doesn't it? I mean, if you're flagrantly committing Medicaid fraud, and maybe time to go to prison, whether you're a doctor or a mom. I mean, obviously, we don't want to throw a bunch of moms in jail. I mean, that's much as obvious. But the other side of the coin is there has to be some accountability here, on both the consumer and the provider side, because some of these things that are going on out there. I mean, there was some bizarre incident where like 80% of all HIV drug costs were coming out of one state because some company was just committing fraud like crazy. Unfortunately, they got caught. But these things are happening, and they're expensive. And people have to at least feel a little bit threatened is my only real point, so that we can keep them from committing these crimes.
In the administrative health panels that you're talking about, you said that the current system just only benefits the lawyers. Do people not have representation by a lawyer going into this panel? Would they just be on their own?
If they could hire an attorney, they'll have, hopefully the patient advocate stands up and shares this thing for the benefits of the patient. That's their job. They're the patient advocate, and they should be standing up for the patients. And the patient's going to be well aware of what goes on in the proceedings, and if they want to have an attorney, that's fine. There's no problem. My only point is that most of these cases can be adjudicated in no time, very easily, for the benefit of plaintiffs and defendants. And so why do we have this incredible merry-go-round going on? There will be cases that will go to the state courts. I know that. That's okay. But let's get most of it taken care of in a timely and prompt manner. Physicians don't mind answering in a reasonable sense for their actions.